All right. Well, for the sake of punctuality, let's kick things off. It looks like we have a nice group of people already here with us. So welcome. My name is Carrie Scott. I work at Spruce Health. I have an incredible panel joining me today to talk about how to avoid the pitfalls of launching and scaling your own practice. So we have some good stuff on tap. We're going to start with some quick speaker intros. We're going to cover off on what Spruce is, what Elation is, and what Hint is for those of you who are new to any of these solutions. And then we're going to talk about how the solutions work well together. We have some really good questions lined up for our panelists that will perhaps cover some of what you may already have lined up, but then we're going to open it up to questions from the audience. So please do make sure that you come prepared and you've got those ready. You can drop any of your questions into the Q&A at the bottom of your screen, and we will answer them as we go. So don't hold back. Be sure you share those with us. That's why we're here today. So getting right into things, I'm going to introduce Jessica Goulish. She is the head of sales at Spruce Health. There she is. We've got Dr. Sarah Pastor joining us from Elation Health, Director of Primary Care Advancement. And we have Lauren Tancredi joining from Hint Health. She is a growth specialist. And I'm going to let each of them just jump in, maybe say a few words about themselves and about the companies that they work with, and then we'll get into the meat of things. Jess?
Hi, everyone. Thanks for joining. I'm Jessica from Spruce, and just wanted to give you a little bit about our company. We are a communication platform for healthcare offices. We do everything from your in-office business phone system to using your cell phone for your healthcare business, fax, texting, telemedicine, and just general team collaboration around all those different communication channels. So that's a little bit about us. You'll be hearing more about us through this presentation. Thanks, Karen.
Dr. Pastor?
Hi, I'm Sarah Pastor. I'm a family medicine physician, and I'm the Director of Primary Care Advancement at Elation Health. And so my role is really about evangelizing primary care all over the land, which I feel like is the best job in the world. And Elation Health is what we call a clinical first EHR platform. It's really designed around the doctor-patient relationship. It was developed inside a family medicine practice around the unique needs of primary care, and is really modern EHR technology because we have an open architecture which allows us to integrate very easily with other software solutions like Spruce and Hint to create a seamless workflow. So unlike legacy EHR platforms that are sort of closed and bureaucratic, Elation provides that openness and the ability to create sort of a digital ecosystem, and is the most popular EHR among DPC practices all across the nation.
Awesome. And my name is Lauren Tancredi. I'm the practice development lead at Hint Health. I help all of you focus on growth so that you are thriving in your practice. And so Hint is focused on membership management and billing software that streamlines your operations so that you can do what you do best, which is take care of your patients. And so we do things like automate member billing and enrollment. We work with employers using our eligibility auto sync, and you can even run a direct care network if you're really looking to scale. Plus, there's a little bit of our features that are like a CRM Lite, where we can see who signed up, who abandoned the cart, and help you really go after folks from a sales perspective, which isn't usually part of your repertoire when you're doing fee-for-service type work. And so the most beautiful part is we integrate with our partners here, Spruce and Elation, so that you can have visibility into who are your members and who's active in your system.
That's awesome. Thanks, you guys. Before we get too much further, I'm just launching a real quick poll that I would love for you all to answer so that we have a better sense of who's joining us today. You should see it on your screen. Good. I see some folks answering. And then I'll share the results. And that way we can suit some of our content to your needs. So I'm going to give it a few more seconds.
Also, a reminder, everyone, if you have to cut out, you have to, go see a patient or anything, we're recording this. So you definitely can do that, and you can just watch the recording later, because I know that question's going to come up.
Yeah. Thanks, Jess. Okay, I'm ending the poll, and I'm going to share those results so that y'all can just take a quick look at who weighed in.
Cool.
Yeah, looks like we're kind of spread evenly there. So good stuff. Thank you so much for answering that. All right, let's keep this going. And here we go. I'm going to let Jess just jump in and talk a little bit about the solutions. Well, actually, let's have Dr. Pastor speak to Elation, and then Lauren jump in, and Jess, and then we'll talk about how they work together.
Okay, thank you. So as I mentioned before, Elation is this clinical first EHR. So it's purpose built around the doctor-patient relationship. And so it really simplifies charting, minimizes administrative burden, maximizes your time with the patient, gives you real-time access to customizable reports, and helps you manage communication inter-office, and do all kinds of clinical tasks without death by 1,000 clicks.
Awesome. And so as I mentioned, Hint Health, we do your membership billing and enrollment. We get to put the little click links on your website so that people can go online and sign up if that's the way that you want to do it, or you can admin yourself in the back end. We also have a really great dunning system that continues to charge your card if the card is defaulted at all, and notify your patient with our custom notifications. And all that stuff can be branded to your personal clinic. Not only that, you can have various plans. So if you've got different tiers or age groups or family discounts, all of that stuff is fully customizable within our back end. And the best news is it drops right into your bank account. As soon as we get paid, you'll start to see that money show up as well. Plus, there's some great financial reporting for all of you who want to make sure that the dollars are making sense at the end of the day.
Yeah, so Spruce, as we talked about, it's a shared inbox for all your communication. It's all HIPAA compliant, so you don't have to worry about that. We've thought of everything for you there, so you can feel good, because we only work with healthcare offices, and then we also have virtual care. Also, just wanted to kind of talk, the three of us are all separate companies, and we all work a lot with practices that are growing. And so that's why we thought this would be helpful. Although we're separate, we work really well together because we have this integration. So wanted to kind of talk about how we work together. Obviously, you can use this each separately. And I think a lot of people in this call may use one or multiple of us, or shout out for all those that already use three. But the next slide, I just wanted to talk about how the integration works. We're not going to get deeply into how the integration works today, just because it's there's videos and demos, and we really wanted to show you today about scaling your practice using modern technology like the three of our systems. So first, when you're using all three of these systems, you're going to be able to make sure that all your patient data syncs through all three systems. So you don't have to worry about that. You don't have to worry that it's in one and not in the other. And everything is customized based on what your business goals are, whether they're, I don't know what I'm doing yet, I'm just getting started. We can help you with that. Or, you know what, I already have 5 providers. We're ready to add employer contracts. We're ready to add more patients in. You can do all of those things within these 3 platforms. So, and also, it is all about the patients. We want to make sure that they feel heard, that they're getting documentation of their clinical notes, they're getting access to all the communication they need, and you don't want to have it be repetitive. So it all is documented in these software programs. So we want you to just be seeing your patients and not worrying about all these nuances, because that's what you were trained to do. All right, so the next slide, I'm just going to show you kind of a little bit of how it syncs. So how do they actually integrate? So if, let's picture you starting a practice and you have a membership-based practice, for example, or you're just having a practice that you offer care to a certain patient base. Well, they sign up in Hint. And so they put their demographic information in Hint, And then they either do it themselves on your website or through their employer, or maybe you manually add it and it goes in Hint. Then it automatically creates a patient chart in Elation with all that beautiful demographic information that was just captured. It also creates a contact in Spruce, meaning when they call your office, it's going to show the caller ID. When they text your office, it's going to show the caller ID. And then once they text you or leave a voicemail in Spruce, because it's your phone and you're texting, it automatically can get synced to the patient chart in Elation. And so it's all but two-way syncing. So as you know, someone changes their name in Hint, or maybe they're not part of your practice anymore, you're going to know that in both Elation and Spruce. So we've really made it easy for you just in one click to have everything work together. Obviously, there's a lot more videos, images, and how this all works. I was just on a call with a pediatric practice asking how it works. So we can definitely go into those nuances. You can talk to any of our teams and we'll go into those. And just, click below to the Q&A and ask your questions and we'll get them answered at the end, or if they're exactly what we're talking about, we'll answer them during that slide. Ladies, did I miss anything? Okay.
Sounds good.
That was great. Thanks, Jess.
Yeah.
Really good stuff. And with that, I think you've set us up perfectly to just get right into the heart of why we're here today, which is talking about how you can launch or scale your practice with some key tools in place. So what we're going to do is round robin this, and that way y'all are going to get the benefit of hearing from each of these wonderful women, and they're all going to weigh in on the questions that we have presented here today. So starting off, I think the burning question we've got is, why is technology important to a healthcare practice? And can you apply technology to all specialties?
Yeah, so as we know, technology is not going anywhere, and it continues to transform modern medicine, both in its clinical applications and administratively. So you're not going to be able to hide from it. You might as well use it to your advantage. And when it comes to how you deliver care and document it, choosing the right tech is really essential for your workflows, as well as how you're managing your patient expectations. So the beautiful thing about how we all work together is you can use it from your prospective patients all the way down to your current patients from communication perspective. They can access their PHI, and from a Hint perspective in particular, like they can enroll and pay their bills online. So my biggest thing is there are different ways that people want to communicate with you. And in the digital age, it's so important to be really tech forward. And so this platform or this tech stack actually makes that happen. And whether you're in primary care or another specialty, I think it's really important that you consider what is your patient experience as you're bringing on new tech platforms to your practice.
Mm-hmm.
Yeah, I mean, I think it's also about the specialties. I think it's important to use a technology that's going to be able to be flexible. I was just talking about Spruce earlier, in that, we have pediatric practices, we have cardiology practices, internal med, all these different types of practices, or a practice that shifts. Maybe it just starts with one provider, then adds a staff, then adds another provider. You really need to make sure that it's flexible to grow with you and your specialty. So if you don't want to offer a certain thing, make sure that your solution can. So that's one thing I definitely like to check out. The other is documentation. So you really want to make sure that you're documenting, right? But don't bother documenting manually. Use technology for this, work smarter. In Spruce, we document every phone call that you have out. So you're did I call that person back? Oh yeah, I did. Oh wait, did my staff call them back? Oh yeah, that's documented too. I don't need to remember all that stuff, especially when you're working on someone's healthcare. Don't worry about did you call them back or did you text them back? It just use technology that works smarter for you and your team. That's kind of my 2 cents.
So as a family physician, I really come at this from a primary care lens, and high value primary care is very dependent on technology. Health information and technology enablers are powerful tools to inform clinical decision making and really required to drive better outcomes at a lower total cost of care. And so we need a comprehensive data set. We need solutions that drive collaboration, the ability to track and close the loop on services, the ability to engage patients in their care, and so many capabilities that technology can enable. But primary care doesn't operate in a vacuum. We operate connected to an entire healthcare system. And that system currently is too fragmented. And this introduces avoidable risk to patient safety and avoidable costs to the care of a given patient. So technology is so important to serve as sort of the grand integrator so that everyone participating in the care of a patient knows what everyone else knows. And this is crucial, not to be dramatic, to transforming healthcare in America.
That's great. Thank you, all three. Good answers. Moving on to the next. So what are the key things to consider when selecting new technologies? Dr. Pastor, we'll start with you.
So for me, the activities of primary care are unique in all of medicine, and no other medical specialty takes accountability for the total care of the patient and serves as the integrator and coordinator and advocate for patients as they make their journey through the complex healthcare system. So at the heart of this is the doctor-patient relationship. And legacy EHRs have eroded this relationship through, again, death by 1,000 clicks and painful workflows. And so when you're choosing an EHR, it's so important to consider the user experience that feels intuitive so that it works like you think. And you want a pleasant user interface so that it doesn't feel overwhelming and you can easily find the information you need and take the actions that you want. And you want the ability to deliver care proactively and collaboratively and provide and manage care outside the four walls of the clinic through virtual solutions, care coordination tools, patient engagement tools, and making it easy to get fairly reimbursed for the work that you do.
Yeah, agree. I think, it's really important to think about your practice and like where you want it to be today and tomorrow, and make sure that those technologies can do that. I think all of us, hear about people starting new practices and, and different things. And you just want to make sure like, yeah, maybe it works today, but it needs to be scalable. So we work with a lot of people that use a personal cell phone, or, I'm just going to start capturing patients in my phone, and yeah, it works fine. But just make sure that it can work with a team when you hire them and you don't have to start all over. Also, Sarah mentioned, like it has to be in a, for your whole team to use, like you don't want it to be siloed. So if, messages are coming in and you're seeing a patient, what you need to be able to have someone handle that, or you need to make sure that the messages are getting auto replied when you're in an hour-long new patient visit. So have autoresponders. So get technology that's going to do more, like act as more people than just yourself. And then also, these are some common things that I just like to emphasize that you need to make sure as well. Make sure it's secure. Make sure it's HIPAA compliant. Make sure it's built for your use case. There's a lot of business systems out there. There's a lot of EHRs out there. There's a lot of ways to charge your patients, but like you need to make it work for you. Technology is so wide now that you can actually choose the one that's perfect for you. And so that's another thing I love to talk about. And read the fine print when it comes to security and HIPAA compliance as well. Just because they say it's a BAA and the HIPAA compliant doesn't necessarily mean that everything in their platform has been taken care of. So make sure the owners of the businesses, I think all of us have, healthcare experience within our businesses. And that's important because then they understand what you've done and what you want to do. So those are some of my things. And also other new technologies, don't be too blown away by marketing. Make sure the product works for you and is easy to use. Because if you can't use it, it's going to be a big challenge for your practice. So just make sure it's intuitive and it makes sense to you.
I love that, Jess. I think that security and compliance is one of the things we don't talk enough about in this
No,
space. And it's
totally.
absolutely something that could be a top consideration, especially given the state of the world, right? And so absolutely one of those things. And I like to really like plan technology needs around the patient experience so that we're like working smarter, kind of what Jess was saying earlier, and not harder, that you're automating where there's possibilities to automate, and you're integrating where that's also a solution. And so in my mind, it's like when I work with practices, we're mapping out the first 12 months and then figuring out like what tech do we need in order to deliver on the experience. And on the other side, is there a person who can catch the information on the other end, like Jess was saying too? You don't want to be working in a silo. You also want to have super users. So a lot of times we bring in all this tech and then nobody's watching it, and totally dilutes the patient experience, and there's information that gets lost. And so considerations would be like, what's my experience? How do I leverage technology? What can I automate, and who owns it in order to deliver what it is I'm promising on?
Nice. All right, good stuff. Why would you say it's important to integrate solutions?
I mean, this kind of goes with the same theme that I guess I've been having is, documentation. So you can work smarter, not harder. And then also, if it integrates, it's just, that's taken care of, that you're not missing it. It's going there, it's syncing up. You're not giving out care for people that aren't paying or aren't patients. So that's also important, not to, when you're a small business owner, you really want to make sure to use every minute valuably. So those are my 2 cents. I've already talked a little bit more about this, so I'll skip.
Yeah, I have one thing actually that could be a good question for what we're talking about right now, if that's all right with you guys. Courtney wrote in and asked, she says that she loves the demographic information flows from Hint to Elation, but she's a little confused about the insurance information. When a patient changes their insurance, does she need to update Hint or just Elation?
So right now we have a unidirectional rollout with Elation, which is becoming bi-directional in 2023. And so we've had a soft launch. So what does that mean for you? It means that right now, in terms of insurance, if it comes into Hint first, it gets pushed into Elation. If you haven't already asked for the rollout, I believe 2023, January, we're updating all of the practices so that it doesn't matter which system you put it in, they will be speaking to each other. But if somebody came into your office tomorrow and you needed insurance information updated, you want to make sure that gets updated in Elation today. That way you have that information on their lab requisitions and their order forms, because we don't really do anything with it on the Hint side of things except for push it into Elation today.
Yep, that's right.
Perfect. And Lauren, did you have anything else you wanted to add?
Yeah. So it's really kind of astonishing the amount of technology. Like a lot of the practices that I interview, they have like 12 pieces of tech, 12 different logins, 12 disparaging systems, right? And so this is what makes integration like so important, because now you've got a source of truth, and kind of like what you were saying earlier, Courtney, it's like the information's flowing through, right? And we're continuously putting on our roadmap and product improvements so that it's talking in bigger and better ways. And just thinking about all the places you have to log in sometimes can be exhausting, right? And so the more you can get your pieces of tech to talk, the more seamless, ideally, your process will be.
Totally agree with that, Lauren. You took the words right out of my mouth. Really in the digital age, it's just not possible for a single technology solution to support every single capability that you need. And so in the modern era, we need to think of it as a digital ecosystem, kind of like your smartphone, where you have a core EHR, but can add or integrate a customized combination of software to create a seamless experience for the entire office. So this allows the front office to perform efficiently and lets the doctor spend more quality time with patients so that you get all your work done without grinding your gears and feeling overwhelmed by too many passwords and fishing for information in disparate systems.
Excellent. Why would one need all of these tools if we're just getting started? And is there anything that they should prioritize?
So Obviously, I come from this, from an EHR perspective, and having an EHR where you can store patient information and manage patient records and care for your patients is foundational. But you also need to be able to bring in revenue to sustain your practice. You're not going to go very far without that. And you have to have a phone so patients can contact you. You're not going to go very far without that. And actually, in a recent study, it showed that the number one things that patients value about the DPC model is the ability to communicate with their doctor. So that patient engagement piece is also key to attracting and keeping patients on your panel. So as far as prioritization goes, it's hard to pick just one, since you really need all three to run at a sprint, but it's important to start with the EHR a little bit earlier in the process, just because of the credentialing requirements involved in being able to prescribe and order services for your patients through the EHR.
Yeah, we have another question coming that's going to talk also about kind of when to set things up, so we can go into that, those details as well. But yeah, I think that you should prioritize what's going to make you feel most comfortable. I mean, I always joke, I talk to a lot of practices starting. I always joke that I'm a therapist for new doctors starting businesses. And so I think whatever is like weighing the heaviest on you to do that first, so you can move on. Or if someone comes to me and we set them up with a phone today, I'm like, you're done. You don't have to worry about this. Go make sure your credentialing, your EHR, your billing, all your revenue is all set up. Like, just don't even worry. This is it. It was that easy. So take the easy wins, get those done. If that's kind of your method of task management, or take the hardest one, and get that, and prioritize that. This is also going to depend on timing. So if you're a year out from starting your practice, you want to start exploring all these things, but you might actually want a phone number a year out, like just so you can stop using your personal number. But you don't need to sign a contract for an EHR a year before, right? You may not have a location, you don't know your date. So different things are going to matter based on time. But you got to have the legal stuff definitely up there, because, legal always wins, or at least always prioritized. So yeah, unfortunately, you do have to prioritize a lot of things, but just do what makes you feel comfortable and makes you feel like you're getting your business started, because the other stuff will come eventually. And Lauren's,
yeah,
I mean,
I've done one or two of these before. But yeah, I mean, I think Jess, you kind of hit the nail on the head. Like, it really depends on what your goals are and how do you align your tech with those goals, right? And Hint is great because you can pre-enroll people into your practice. You know what your financial forecast is. You can start to get money and fund all of the things, right? And you need a phone number. And if you're starting to take care of patients, you need an EHR. And so, I believe like the trio is exactly what you need. Invest in yourself early, because if you start investing in you, people are going to invest in the vision that you're bringing forward.
I love that. Thank you. Okay, so I'm a solo practitioner. Do I need all three solutions?
That's me. Yes, heck yes. You want all three. I just said that. And from a Hint perspective in particular, like, essentially it was designed because it took away the job of needing a full-time administrator to be able to run credit cards every month and call on collections and do all of the things. And so if you're really operating as a solo person in a practice, these tools stacked together can automate so much that would alleviate the burden of bringing in somebody really early to your practice, help support you in doing the admin work that could be really timely.
Yeah, I hear this all the time. Oh, I'm only solo. I don't need that yet. I'll do it once I grow. Well, it's kind of the chicken or the egg scenario. How are you going to grow without, reaching out to patients quickly? Or if you're too bogged down with a lot of the documentation or managing multiple devices, you're not going to be able to spend time marketing and advertising or talking to potential patients. So I actually emphasize that the solos need it even more, because you don't have any help yet. You don't have someone to answer the calls when you're busy on another phone call or in a patient visit. So solos, hands down, you need to have the most modern technology to act as more than just yourself. and you can't afford to miss a call. So what do? If you're in a patient, you have an auto text back for a missed call. You have the bulk messaging from any of our systems. You can bulk email them, bulk text them, reach out to patients that may be came in for pre-enrollment, invite them to a party. Like there's lots of stuff you can do just on your own that makes you seem bigger. And we even use Spruce in our own business to run. And people are always like, you seem so much bigger. It's like, yeah, because we use technology to make us reply back to people. So you need the technology and you need all the systems, because also once you're growing and you're busier, it's going to be way harder to implement and make changes to your workflows. So I'm very passionate about this. If anybody else wants encouragement on not, on having the piecemeal together when you're solo, I can continue on. But I'll let Sarah bring.
I love that, Jess. I'm going to just jump in real quick.
Oh yeah, do we have a question?
Well, no, this is something that just lends itself nicely to what you were just saying. I just got off a call with a solo pediatrician, and she was saying, oh my gosh, I think I waited too long. I should have set up one phone number for non-patients, people who are just learning about me, and one specific number, maybe even a secret number for patients. And to your point, it was like, she really wished she'd gotten ahead of that because now she feels like it might be too late. But getting that stuff in place early is essential.
Absolutely. Another example I should have brought up is the personal cell. Like I have so many people that will come to me and be like, I've been using my personal cell, and they'll be like, now I have all these patients in my personal cell and they're all texting me. Oh yeah, they're going to text, which is great. Messaging is great. Dr. Pastore mentioned that stat, like they love communication. So let's do it, but let's do it in more manageable. There's an auto text back if it's after hours, after hours go straight to voicemail, like set them up from day one so that that's the expectations of your practice. It's going to be so much hard. I just had to transition someone that had hundreds of patients calling their cell phone. So changing that behavior is way harder down the road.
Yeah.
And I'm going to speak to your cell phone case real quick too, because not only does Spruce have the texting capabilities, it's secure and you can add it into a chart note in Elation. And so like you just like solved for so many problems if you've got yourself set up for success from the beginning.
Oh yeah. You can sync any voicemail and text to Elation, I don't know many other phone systems that are going to do that easily and work as smoothly.
Nice.
Yeah, it's hard to think of anything to add to this.
Sorry, went off.
No, it's great. I'll just, reemphasize the point that like, this is one of the main points of even having technology in the first place is to automate something which is so much cheaper than throwing bodies at it. So I think, in a solo practice, more than anything, you need that automation because it's just more efficient.
Yep. Good point.
And we're getting some really good questions, and they're relevant to our questions coming up, and then we'll answer the more general ones at the end, but I'm excited to answer them. So we will get to them, my friends. I see them.
Perfect. Love that. Okay. And Jess, you were just on this. So yeah, she teased this one out, but when is the right time to set up these systems?
We also got a question from the audience saying, when setting up my practice, at what point in the process or timing should the provider set up for their EHR? Or sign up for EHR. So we'll address this right now. For Spruce, I definitely say the minute you call or text a potential patient from your cell phone, your personal cell phone, or the minute you want to advertise your practice anywhere or set up credentialing, you're going to need Spruce. You want to start capturing potential patients as soon as you have the idea to have your own practice. I mean, that's really it. Like, in one world, we really see that everybody has a virtual phone number as a clinician, whether or not you have an independent practice. Just never use your personal cell phone. So it's always separate. So you know the differences. But if you're starting your practice in 6 months, you may not need it till 3 months before. If you are setting up desk phones, so Spruce has in-office phone systems. So we offer VoIP or voice over internet protocol internet phones. So just old school desk phones, those. And then if you also want to set up phone trees, like how you reach my practice, press 1, press 2, We like to give 3 to 4 weeks because sometimes it takes a minute to think of the content for those. So we'd say ideally, if you're setting up an in-office phone system, about 4 weeks or 6 weeks before you open. But again, we have tons of promotions for new practices starting. So it doesn't mean you have to start paying 6 months before. We're going to hook you up. So we want to make sure that you are starting to use a separate system than your personal cell. And I know Lauren sets up a ton of practices as well, so she can probably speak to this, and then we'll let Sarah get to the EHR question.
Yeah, I mean, give yourself adequate time. The last thing you want to be doing is like building the ship when you're sailing it, right? And so, like Jess said, like we grow with you. You know, a lot of us are growing when you're growing. And so talk to us about what your goals are so that we can come alignment and have the same incentives for like from a monetary perspective, right? In terms of Hint, we can get you set up in a matter of minutes. Basically, you sign the contract, we create your account, and then we can configure Stripe in 10 minutes or less. So the big thing is, do you know what your pricing is? Do you know what membership you're going to offer? What age groups? Like all of that planning work that's got to get done. And so once you're clear, you've got your legal, you've got your contracts, and you've opened your bank account, like you're good to go. We can set you up pretty quickly. So when you're ready to take money, then you get to come to us.
Yeah, so I'd say for the EHR, it depends, but in general, 45 days should be enough. And basically that's just because you need time to get set up with an Elation account and set up your lab integrations, but most importantly, start the credentialing process. That's the part that takes the longest. So, but your sales rep will guide you.
Okay, perfect. Okay, so what if someone is adding a new provider to their practice? Is there anything that they can do to prepare for that?
Oh, I mean, this is like a loaded question, right? So when you're ready to grow, we're here to help make it happen. From a HIT perspective, all you really need to know is your provider name. If you wanted to put like panel size limits on there or how your provider is going to be part of your organization, like we can totally do that. Now, there's obviously a lot of ways that providers are joining DPC practices right now. They're either employed, they're subcontracted. And so financially, we can set up some of that background information too for you guys. And if you're like, hey, I got a new employer group and I'm not even like trying to hire an employer, but I want to create an affiliate practice and now you've become a network, Hint can help support that process too. And so there's a lot of kind of creative and innovative ways that you guys can grow and expand. And so, you know, I don't know that there's anything that you could prepare for except for like the excitement of like you're forging new paths. You get to decide how this gets to work for you and support the people that you're serving.
Lauren, I actually saw a question that's kind of relevant that I thought we'd put in here. So this is about Hint. And so Hint does a lot of membership-based practice pricing. And this person's asking, are you able to do a bulk pricing update? So for example, if prices were to change at the beginning of the year, is there a way to easily make that membership fee transition? And would it be by patient account?
Yeah, so
okay.
Yeah, totally. So
yeah.
DPC Accelerator, which happens every Thursday, where we teach practices how to do things like this and grow their practice, right? So this week we are touching on this subject because it is that time of the year and you want to make sure your membership plan changes are happening and in the system by November 15th. So we will show you how to update your membership plan, right? So your entire plan into a new plan, right? So if you've got 100 patients paying a current price, like a lot of times I set up a practice and we have like an early adopter rate. Then 2 years into practice, they decided like, oh, I need to charge more, but their early adopters are still grandfathered in. And now it's time. Okay. We've like seen 10% increases all across the country. Like, let's make this happen. You could slowly start to move them into a new plan tier. So Hint can absolutely do that, as well as they have a plan design feature where we can package things like RX and labs into a particular membership type. So I hope that answers your question, but come to the accelerator lesson this week and we'll show you how to get ready for that.
And Sarah, there's a question that you might want to answer in this one too. It says, does Elation help with the credentialing process and the billing, or do we need to hire a biller? So this is kind of related.
That sounds like it's probably related to credentialing with insurers. And I think that's a separate process as far as I know. But we do help. And So that's in our RCM part of the organization. So the credentialing that I've been speaking about is really more around the prescribing process. But if you are going to work with insurers, we can connect you to the right partner to help you get those credentialing requirements taken care of.
Okay. Perfect. Anything else on this subject, ladies, or shall I keep it going?
I'll just address from the EHR perspective about adding a new provider to the practice. And so we just need to make sure that they're added to Elation, and again, that they get credentialed for prescribing purposes, and then initiate integration requests with both Hint and Spruce. So I would say notify Elation maybe 4 weeks in advance.
Okay, perfect. We've already addressed that one. Okay, what are some key things to be cognizant of to avoid unnecessary roadblocks? And that's a big sweeping question. So y'all can touch on anything that feels right.
Well, I hate to keep harping on the credentialing piece, but that really is the most common cause of delay, is that credentialing process, not for insurance purposes, but to be able to prescribe and provide total care. That process is not controlled or defined by Elation, and customers sometimes balk at the documentation requirements. And sorry, guys, it just has to be done. So to avoid delays, just submit all the requirements as quickly as possible, and then we won't have to worry about those delays.
Yeah, I think on the poll, and I don't know if you can still see the stats, Kara, I think it was like 22% were thinking about starting a new practice that are on this call. So new practices, credentialing, 100%. The other thing that I see that I get an email from a lot is, oh, my location, the construction got delayed. And it just breaks my heart. Again, I'm there for, as a therapist, doctor consultant, included in your Spruce fee. And the location and just expectations with construction and location definitely can be disappointing and delay practice opening. So that is like a literal physical roadblock. So just make sure that you have a contingency plan. We can always set up, your business phone number, no problem. You don't have to have a physical location, and you can start charging and seeing people at home or in a temporary office, and then you can move your phone to your permanent office. So that's a definite roadblock. But those are the two main things I see. But Lauren probably has a couple more to add.
Jess,
I just want to say,
oh, sorry to interrupt. I was going to say, what about like if someone has a phone number and they want to transfer it? How much time do they need to afford for that?
Oh yeah, that's a good one I didn't address. So if you already have a business phone, either because you're an existing practice, or maybe you just got like some random virtual phone, or you got a second phone, you can port that, which means move the phone number from the other phone system to Spruce. That takes 1 to 4 weeks, but there's no disruption in service. So it moves seamlessly over at the scheduled time. But it's a processing time. And since I'm answering that question, I'm just going to answer another one that came in. Someone asked about like if you're using cell phones, either a business cell phone or your personal cell phone with dual SIMs. So that means like 2 phone numbers on 1 phone. We can port that second SIM to Spruce, and it will all go through Spruce. So you can access everything on your computer or the mobile app, and it still uses your personal phone. So it's like the best of both worlds. It's using your personal phone, so you don't have to charge 2 phones. But it would be a replacement for any business phones you have. Sometimes will be used as just like an after hours number, and then you keep your whatever business phone system you have. But eventually most people move over to Spruce because you fall in love once you're
all right. So my biggest roadblock is probably you, because a lot of you get in your own way and you want to show up and be perfect. And this is the space where you get to play and make mistakes and try different things. Like the business space is way different than practicing medicine. So play, lean in, connect with the community, because there's a lot of DPC practices, physicians, nurse practitioners, everybody out there is totally willing to help and provide guidance for you. So seriously, like lean into your community, ask for help. You don't have to be a lone wolf doing this game by yourself, because it will lead to burnout really fast. And that's the thing we're trying to avoid at the end of the day, right? And they've done it before, so you might as well learn from their mistakes. The second thing is vet your technology. Totally vet it. Now, as a payment processor, I'll share a story. Like, memberships are our jam. That's what we do, right? And we are very recognized in the space of membership billing. We see volume come through our accounts. I had consulted with the practice that I transitioned from fee for service over to membership, and they didn't want to leave their merchant processor. We had a bulk amount of money go through. Their accounts got frozen for 4 months. No money for 4 months until we could clear it up and make sure that they weren't embezzling money. And so work with people that are in their lanes. Like, we are all in our zone of genius here. We do payments, Spruce does phones, Elation does the EHR. We all do our sweet spot really, really well. And combined, we make a stellar tech stack for you guys. So look at your vet your tech, make sure that they've operated in this space before, so that you're not getting put up against roadblocks that they haven't experienced.
Nice. Thank you. Very comprehensive. For all three of you, what is the one thing, if there is one thing, that the most successful practices you work with have in common?
I think I just said mine. I'll just be quick, but it would be like, play with this. This gets to be your dream practice, right? And ask for help. That is like the one thing. Like, the people that are doing it and doing it really well have a really good community within this network of DPC practices.
Yeah, I think that connecting to the DPC community is so helpful. And I've met so many of those guys, and they're just awesome. And they really are in the business of rescuing primary care in this country, because DPC is the pathway. And, I can look at a lineup of a mixture of fee-for-service docs and DPC docs, and I can pick out the DPC docs. They look fit, they look well rested, they're tan, they just have such better life work balance. And so definitely connecting to that community to understand what they've done to be successful, and then a good marketing strategy. I mean, I know DPC docs that are just crushing it on social media. They're on social media every day, just sharing tips and like little videos, and talking about their practice, and introducing, new team members, and just anything that you can do to get your name out there and attract new patients is really key to success.
Yeah, it's so hard, one thing, but I think kind of on theme, like, engage with your patients. Like Lauren said, have fun. Sarah said, market, engage with them. Really be quick to respond. I mean, you're starting your own practice, from what I've heard. For most people, what they say is to kind of get out of the grind of the big healthcare systems. And, I want to be an independent practice owner. And why do you want to do that? To connect with patients. So do it. Use tools that make sense. Don't be scared of HIPAA. We had you covered. Like, you can text, you can send emojis, you can send fun videos, like you can send memes in Spruce. Like, it is okay to have fun. Patients want to see doctors they relate to and they care for, and that take care of them. And so just have some fun, but, use the tools that you have. Be modern. People have higher expectations of communication and of tools and software today, but you can provide that for them and they'll choose you. So that's where I've seen the people be successful, or like Sarah said, they're on social media. Like, that's where we communicate with our friends and family. So, act like everybody else. It sounds weird, but you get what I mean. All right. That's my answer for one long one.
I love it. That's perfect. That may be our last. Oh, no, look it. Okay. So how does your solution help an existing practice scale? So now we're not just talking about a brand new practice opening its stores, but say you're already established. How can they scale?
Yeah, I mean, it's probably too technical to get into the details here, but I'll just say that although some EHRs only support a solo practitioner or a single location, or things could get messy and chaotic when you try to scale, Elation customers range from the solo practitioner to large enterprise organizations and all points in between. And we easily support multiple practitioners and multiple locations under a single brand, even in multiple time zones. So we do have that capability to scale.
Awesome. I've talked about it. We automate the billing process. So taking away that full-time employee need really, and the whole dunning process, which is kind of phenomenal, where we keep charging patients or attempting to charge, sending them notifications. So it takes a little bit of that financial management out of your work, right? And not only that, if you're really looking to expand both with Hint Connects and our other affiliate practices, we've got employers coming to these people looking to place lives in areas across the country. And so, you know, we have this whole affiliate network where you could either grow your practice into providing lives to other practices within the DC network or be the recipient of those lives. And finally, my shameless plug, I run the DPC Accelerator every Thursday where we talk about growth tips. We've had Jess on talking about how we create automation and workflows and like really giving you pragmatic tools to enhance and grow your practice.
Yeah, I think your existing practice, again, making sure to capture every single potential patient and following up with them. Every single call, every single text that comes into Spruce could be a task. You can put it into a tag it with potential patient, and then you can bulk text these people, or at least have someone go through them. The second thing is, you know, do more with less. So how do you scale? You scale by seeing more patients with less work. And so you can do that with technology, as we've covered today. And then using, you know, all three tools or any three tools that are connected, because you want to make sure you don't have to do that extra work to document and know what's going on. And then when you have your new staff person, so you're scaling, you could just plug and play them into your entire workflows and they are going to pick it up immediately. Yeah, great.
Nice.
So many questions. I only.
I know. Well, I was going to say, now we have about 8 minutes left, so this is perfect. We can get to those questions. Jess, I know you're in there, and I love that, you know, you've kind of been sorting through some of the more.
Yeah, I mean, I think one that came up a couple times. So, Dr. Pastor, I'd love for you to address this. I work with Elation, so I know I work with a lot of customers that use Elation, and they're all different specialties. But somebody asked, does Elation work in psychiatry, in pediatrics? Do you guys have doctors that use that? They wanted to hear about that.
Oh yeah, we have lots of pediatricians, especially in the DPC space, that are using Elation. And, you know, again, Elation is tailored towards primary care. It may not be ideal for an optometry practice, but if you work in primary care, Elation is an ideal EHR. And as far as telepsychiatry is concerned, we have enterprise customers that's all they do is telepsychiatry. Right. So you absolutely can use Elation for that as well.
And follow-up question to that. So you guys have telepsychiatry. Lauren, could a telepsychiatry membership-based model, could you do that, set that up in Hint?
Yeah, we do both one-time charges and membership type charges. And so absolutely come make your life easy and kind of forecast your finances through membership models for sure.
And obviously you can use Spruce virtually because it's a texting, and we also do telemedicine. So you can do that also through all systems. And I'm pretty sure some of these customers we're talking about, we all work together with. So awesome. Okay. And then another question I think is relevant for all of us. So someone said, I have a clinic with over 1,000 patients through one EMR. Can I transition all those patients and the records and everything into your systems?
Yes, absolutely.
Seamless. And again, you just have to upload them to Hint, and then they'll automatically go to Spruce and Elation. So it's quite pretty, and it goes quickly. So okay.
The process, I'll just say the process looks a little bit different for the clinical data that needs to come across. Yes. So, you know, Hint and Spruce will do the demographic stuff, but we do have a really nice migration process. And, you know, the hiccups that happen really are more dependent on the EHR that you're moving from than on the Elation side.
Okay, I forgot the questions for me. So a few people asked about, do text messages in Spruce go into Elation? There's two different ways to sync your information from Spruce. So voicemails, call logs, text messages, all of that can be synced automatically to the exact patient chart, or you can manually do it to the chart you want. Example would be if mom is texting, you can have it go to the child's chart manually. So you have a couple options there. We have 2 videos on our help article that I can send you. So feel free to email us.
What about speech to text? Just something came in about that one. The question specifically is, do your systems have the capacity to integrate with speech to text technology?
I think that's more of an EHR question.
Yeah.
And yes, absolutely. We integrate with Suki, and we have customers who use Dragon. Yeah, absolutely, you can do that.
And I actually think Dragon does work if you want to like have dictate a long message to a patient over text. You can do that. And we actually just introduced last week on mobile on iPhones the ability to do a voice recording. So that's become very popular in mental health, where you just record the voice of you saying all that, and then they can do the same back and forth. So just introduced that last week. Slightly different. Okay. Does DPC, so in DPC, we've said this, some people on the call might not know what DPC is. DPC is direct primary care, and it is membership based. So patients pay a membership to be a patient of your practice, and they get unlimited primary care, generally speaking. So does DPC work in rural settings, ladies? What, have you guys seen this?
I have.
Yeah.
Yeah. I want to see that
huge.
the adoption is becoming more broad in terms of area, right?
I've seen it work especially well for rural areas that have like a factory nearby, or other sort of employers that you can partner with, get into contract with, and then provide primary care for their beneficiaries.
All right. And one last question for Sarah. How easy, I don't know if you know this, we can also message the team. How easy is it for Elation to integrate with local hospital systems for lab, radiology, discharge, et cetera?
Yeah, I would say that that depends on how easily that hospital system will make that data available. So we absolutely have the ability to pull that into Elation. We can take those discharge notifications and push those into your message queue. But getting that information into Elation is more dependent on whether or not, and how difficult it is on their end to share it.
Nice.
I'm going to answer the rest of the questions typing. And I'll
I was just going to say, yeah, we have so many great questions that have come in, and you guys have been so engaged, and I love it. But I want to make sure to show you this slide, because if you do have any follow-on questions, you can reach out to any of our panelists today directly. They've been so helpful and are willing to answer more. So please feel free to reach out if there's something on your mind. I want to thank everyone who joined us today, but especially Lauren and Jessica and Dr. Pastor. Having the 3 of you on today was incredible. I know I learned a lot, and I'm sure our audience did as well. For folks who want to learn more, you can always check out our websites. I love to throw in a little testimonial, someone who's using the trio and quite happy with it. But I know we've heard a lot of those success stories. So thanks again to all 3 of you. This has been tremendous. Thank you to our audience. And I hope everyone enjoys the rest of their day.
Thank you.
Thanks, everybody.
Thanks, guys.
Bye.